A. France is smiling and happy now, but her life was very different before Ssubi helped her. The nuns at a Ssubi health center here in Luwero, Uganda, found her lying on the side of a dirt road near death, abandoned by her family because she has AIDS, which afflicts 1 in 10 Ugandan adults. A. France is thriving now, making colorful hairbands in Ssubi's sewing program, providing her with a steady income. And her handiwork has improved, thanks to Ssubi founder Laura Luxemburg.
I'm glad the glasses work. It's good.
Ssubi sells A. France's hairbands in the United States, along with bags and beads other AIDS patients make. The money helps them make a living and also get the medications they need.
Multiple times a year, we have buying day. It's all fair trade. They set the prices. They're all artisans. They each come up and they bring what they've made individually and they sell their bags.
Okay, thank you.
We check them for quality. They can fix them if they're not right. Each person is very proud of what they've done. The life expectancy for an HIV positive patient, about 5 years. Some of the people, when they first started in the sewing program, were in wheelchairs. They couldn't hold their head up. I was told they would be dead in a month. And our patients are thriving, not only because of the nutrition and everything, but because of the community that we form.
A. France has made so many hairbands she saved enough to buy a house.
You paid all your debts.
She's also hoping she can soon afford a way to shorten her daily 5-hour walk to work.
I'm hoping I can get enough money this year so I can buy a used motor scooter. I'm tired of walking so much, but still I do because I love my job.
Since founding Ssubi in 2009, Laura has created sustainable programs that have changed the lives of the 660,000 people here. Focusing on education and microenterprise, Ssubi, which means hope in Ugandan, has given this community a reason to be optimistic about the future.
We do a collaboration of sustainable programs that all share, so it's like an umbrella. Under that umbrella, sustainable businesses, the piggery, vegetables, the store, they can fund and complete the projects. That's always been the philosophy of Ssubi, fill those gaps that have been forgotten. And we do that with the people too. We take the poorest of the poor and make them thrive.
The piggery was the first project Laura started, and it's a major source of income for the health center.
The pigs are very important because within a year they deliver 3 times, 9 to 15 piglets. The income from the pigs is very fast. We have so far saved $4,000.
There also are cows and goats, all designed to be sustainable.
We sell the milk to other people and we sell it cheaply. We subsidize our milk so that it is affordable.
The sisters took in 8-year-old Maddox after he ran away from his abusive grandmother who burned and beat him. Thanks to Ssubi, he has a home at the health center, is excelling in school, and getting a lot of love and attention.
Couch and cat. That's right.
Ever since I came here, my life has changed. I like riding my bicycle, and what I love most is taking care of the goats. I also love going to school, and writing is my best subject.
The nuns and staff also are very busy helping thousands who rely on this hospital, the only one within hundreds of miles and greatly understaffed, with less than 100 beds and 1 full-time doctor.
This is a rural district, a rural place. We want the people to get quality services. Give all what we can, but with the best quality possible.
We have a CD4 analyzer which tests the blood, and there's very few in country, so this is a major site for testing for AIDS. We're open. A lot of the health centers that they go to are closed.
I was a little bit tired, but I'm okay. I've been the only permanent doctor at the hospital. Maternity, seeing the children, seeing the adults, doing all the surgeries. You see everyone. Everyone will have to consult you and you have to know everything, you have to do everything. On average, we do about 60 to 70 surgeries per month. Most of our surgeries are cesarean sections. They account for more than 60% of the surgeries we do. We have basically 2 clinic days. Monday and Friday, about 2,000 patients. We see about 80 to 120 patients every visit.
In Bishop Asili, one of our greatest needs at the moment is a critical care unit for mothers or people who have had accidents. We have an X-ray which is functional, but the quality of the images is not so good, so we cannot rely on that.
With Ssubi's support, the hospital wants to build an eye clinic to help the more than 1 million people in the region without access to eye care.
These ones, we remove it. And when we remove it, we don't just throw it away. We take it for goats. They eat it, so we don't throw it away.
Monday, a local villager and self-taught organic gardener, is another special member of the Ssubi family. He plants fresh vegetables that grow year-round and uses a homemade, natural insecticide that enriches the produce. He educates the staff and patients about the importance of good nutrition and saving money.
Instead of getting the money to go in the markets and buy greens, you have your own. It can stay in the sack for 1.5 years.
Enoch, the hospital foreman, is another Ssubi success story.
We're taking people that really want to make an impact and change and be a good role model for the rest of the community. So Enoc's one of those people that started out as an orphan, worked hard. He's in the beading program, and the money that he makes from the beads built his mother a home, and he's building his own home.
I'm building my house. I bought the land. So there are many things from the Ssubi.
If the Ssubi is not there, we'll start. So Lola, thank you very much to come to Africa.
Laura and the sisters have big plans to expand Ssubi and help many more people. With donor and community support, they bought 228 acres of land in a remote area where villagers have no medical care.
Most of the time, people from this area come to the hospital in conditions which are very, very critical because the place is so far and the majority of the people are very poor. Together with Ssubi and Laura, we are planning to put up a satellite clinic, a school, and also a farming program to teach the people about nutrition and agriculture.
The uplifting songs the sisters sing each morning reinforce their prayers and those of their patients have been answered. But they still need help.
For us, just $1 is very, very important. A cent can bring a big change in a life. $1 can buy a kilo of beans, which can feed a family maybe for a week. A bottle of IV solutions, which can save the life of someone who is going to die of dehydration. We are convinced that just $1 from so many people can make a huge difference here. We are looking at a much better future, and this is all because of Laura and Ssubi.
Oh, it's good to see you. I'm proud of the people that are here. I'm proud of the Ugandans. I'm proud of the sisters. I'm proud of the staff. It's not about me. I couldn't do anything. I get the message out, but we work together. Together we're strong.